Let me ask you something before we even get started. Think about the last time you went into your garage, or maybe a storage shed, a basement, to grab something you haven't touched in months. Maybe it was holiday decorations. Maybe it was old tools. Maybe it was a box of things you keep saying you'll sort through one of these days. You walked in, you moved a few boxes, maybe you noticed a little dust, maybe a few droppings in the corner you brushed past, and then you walked out and forgot about it entirely. Now, what if I told you that in that single, unremarkable 5-minute trip, you may have already encountered one of the most quietly dangerous pathogens in North America? No bite, no scratch, no contact with a living animal, just breathing. That is what makes Hantavirus different from almost every other virus people in your age group have been warned about over the past several years. And that is exactly what we are breaking down today completely, accurately, and without the panic-first framing you have been getting from the headlines this week. By the time this video is done, you will know precisely what hantavirus is, how it actually enters the human body, what it does once it is there, why men and women over 60 carry specific risk considerations that most mainstream coverage does not address, and what the concrete, practical steps are that you can apply immediately to protect yourself and the people you care about. I want to flag something right now. There's a concept in infectious disease medicine that is almost entirely missing from the news coverage this week. I call it the quiet window problem, and it is the single most important thing to understand about this particular virus. I will walk you through it in detail, but hold that phrase in your mind as we build toward it. It changes everything about how you think about your exposure risk and what to do about it. Before we get into this, I would love to hear from you. Where are you watching from today? Drop your city or country in the comments below. I read every single one, and it really helps me see who is part of this community. Let's get into it. The very first thing I want to do is ground this conversation in biology, not in headlines, because the word hantavirus is being used in news coverage right now as though it is a single specific threat. It is not. Hantavirus is a family of viruses. There are more than 40 known species within that family, a number that has grown significantly as genomic sequencing tools have improved, and they have been circulating in rodent populations and occasionally infecting humans for decades. The name comes from the Hantan River in South Korea, where scientists in the 1970s identified one of the original strains after studying illness patterns in soldiers stationed near the Korean border. Here is the piece of context that most people watching this week's headlines are missing entirely. This is not a new virus. This is not an emerging novel pathogen the scientific community is scrambling to understand. This family of viruses has been studied by epidemiologists and infectious disease specialists for over half a century. Now you might ask, if it has been around that long, why does it keep resurfacing in the news? And the honest answer is, it never really went away. It is and has always been present in North America, in Europe, in Asia, in South America. What changes is not the virus, it is the level of human activity that brings people into proximity with the specific environments where this virus lives. Here is the first rule of thumb I want you to apply to every health headline you encounter from this point forward. Is this pathogen novel or known? Novel pathogens, the ones we have never seen before, with no established data on transmission behavior or human immune response, are the ones that justify urgent population-level concern. SARS-CoV-2 in early 2020 was the textbook case. Nobody knew how it moved, nobody had baseline immunity, nobody had a tested treatment framework. That genuine uncertainty was the source of the danger. Hantavirus is not in that category. It is studied. Its transmission routes are documented. Its clinical presentation is well characterized. The uncertainty that makes novel pathogens so dangerous is simply not there. That distinction is not a reason to dismiss it. It is a reason to engage with it intelligently, which is what we are doing right now. Before we begin, take a second and tell me your name and where you're tuning in from. I go through the comments, and I genuinely want to know who I'm speaking to and supporting here. Now let's talk about how this virus actually travels from one place to another, because I am seeing a significant amount of confusion on this point, and I want to address it directly. A number of people I have spoken with this week assumed immediately that hantavirus spreads the way COVID-19 spread: respiratory transmission, person to person, being in the same room as someone infected, shared indoor air on a plane or in a restaurant. That assumption is incorrect, and it matters enormously for understanding your actual risk level. Hantavirus, for virtually all of the known strains circulating in North America and most of the world, is not a human-to-human pathogen. It is a rodent-borne virus. Specifically, it lives in the bodily excretions of certain rodent species, urine, feces, and saliva. In North America, the primary carrier is the deer mouse. In parts of Europe and Asia, different rodent species carry different strains of the virus. Now here is the mechanism that makes this virus so quietly dangerous. And this is where I need you to stay with me because this is the piece that most people gloss over. Those rodent excretions do not have to be fresh to be a risk. They dry out, they desiccate over time. As they dry, they break down into microscopic particles, particles so small you cannot see them, that have no distinctive smell, no color, no sensory signal of any kind, and those particles become suspended in the air of whatever enclosed space the rodents have been inhabiting. When a person enters that space and breathes, they inhale those particles. That inhalation is the moment of exposure. Think about the kinds of spaces that create this scenario: a cabin closed up over the winter, a shed that hasn't been opened in months, an attic with old insulation, a barn, a storage unit, a rarely used basement, a crawl space, anywhere that small rodents might find shelter, nest, and leave traces of their presence over weeks or months. You walk in, you start moving things around. Those particles, which settled on surfaces, on boxes, on the floor, get disturbed. They become airborne again. You breathe. You have no idea anything happened. You feel completely fine. You go about the rest of your day. That is the exposure event. Silent, undetectable. No warning system in your body activates because there is nothing to feel. And this brings me to the concept I want you to remember from the opening of this video, the quiet window problem. More on that in just a moment. But first, let's talk about the specific protocol for high-risk cleaning situations because this is immediately actionable and I want you to have it before we go any further. If you need to clean any enclosed space with signs of rodent activity, droppings, nesting material, gnaw marks, anything, here is the non-negotiable sequence. 1. Before you touch a single thing, open every window and door in that space. Let it ventilate. Wait at minimum 30 minutes before entering to work. 2. Put on an N95 rated respirator mask, not a cloth mask, not a surgical mask, an N95. The particle size we are talking about requires that rating to filter effectively. Also put on rubber or plastic gloves before touching any surface. 3. Mix a disinfectant solution. 1 part household bleach to 10 parts water. This is your primary surface treatment. 4. Wet the contaminated areas with this solution before you touch or move anything. You are neutralizing the virus before you risk disturbing the particles. 5. Never dry sweep. Never use a vacuum cleaner in that space without a HEPA filtration system. Both of those actions aerosolize particles directly into the air you are breathing. 6. Double bag all waste material. Dispose of gloves and mask after. Wash your hands thoroughly with soap and water. That protocol, applied correctly and completely, dramatically reduces your exposure risk. It is not complicated, but it has to be the right sequence, in the right order, every time. If this is the kind of information nobody ever told you before, hit subscribe right now because there is a lot more where that came from. And trust me, what comes next, you need to hear. All right, now let's talk about clinical reality. What actually happens inside the human body when hantavirus takes hold. There are 2 major disease presentations associated with this virus family, and they work through entirely different mechanisms in the body. Understanding both of them is important, particularly for this audience, because some of the underlying health patterns common in adults over 60 interact with both of these presentations in specific ways. The first is called Hantavirus Pulmonary Syndrome, HPS. This is the presentation you are most likely to encounter if you are in North or South America. In the earliest phase, it looks almost indistinguishable from influenza. Fatigue, muscle aches, fever, headache, maybe some nausea or dizziness, the kind of symptoms that most adults reasonably attribute to a seasonal bug and manage at home with rest and fluids. Then, typically somewhere between 3 and 7 days after symptoms begin, something changes. The virus, which has been quietly replicating and moving through the bloodstream, begins to damage the small blood vessels in the lungs. Fluid starts to accumulate in lung tissue. The patient's oxygen levels begin to drop. Breathing becomes labored. What makes this presentation so treacherous is the speed at which the deterioration can occur once it begins. We are not talking about a gradual decline over weeks. In severe cases, a patient who was functional yesterday can be in acute respiratory distress within 24 hours. The case fatality rate for hantavirus pulmonary syndrome is approximately 35 to 38%. I'm going to hold on that number for a moment because it deserves your full attention, not to alarm you, but to be honest with you. Roughly 1 in 3 people who develop the full pulmonary syndrome does not survive it. That is a serious number. It warrants serious attention. The second presentation is hemorrhagic fever with renal syndrome, HFRS. This one is far more common in Europe and Asia. Here, the virus's primary target is the kidneys rather than the lungs. It causes significant inflammation of kidney tissue, internal bleeding, and in serious cases, acute kidney failure requiring dialysis to manage. The overall case fatality rate for HFRS ranges from 1 to 15% depending on the specific strain, with the Hantan and Dubrava strains at the more severe end, and strains like Pumila causing generally milder disease with fatality rates below 1%. That range of 1 to 15% is still clinically serious, particularly when your kidneys are the organ under assault. Now, here is where I need to speak specifically to older adults watching this, because this is a nuance the general coverage almost never addresses. If you have any existing kidney disease, reduced kidney function, or are managing conditions like hypertension or diabetes, both of which put chronic low-level stress on kidney tissue, your kidneys are starting from a different baseline than a healthy 30-year-old's. That does not mean exposure is automatically fatal for you. It means the margin for deterioration before the situation becomes critical is narrower. You have less physiological reserve to absorb the assault before organ function is significantly compromised. Similarly, for the pulmonary syndrome, if you have any history of COPD, reduced lung capacity, sleep apnea, or cardiovascular disease, conditions that are genuinely common in this age group, the speed at which falling oxygen levels become a crisis is different for you than for someone with full baseline lung function. I'm not telling you this to create fear. I'm telling you this because it is medically accurate and because it changes one specific thing: the threshold at which you should seek emergency care. Which brings me back to the quiet window problem. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this. Here is what makes hantavirus uniquely difficult to respond to, and it is the piece of information that almost no mainstream coverage is giving you. The incubation period for hantavirus ranges from 1 week to 8 weeks for most strains. For the Andes virus specifically, the strain confirmed in the current cruise ship outbreak, the documented window is 4 to 42 days, with the majority of cases presenting symptoms in the 2nd to 4th week after exposure. Read that again, 1 week to 8 weeks. That means the gap between the moment of exposure, that unremarkable 5 minutes in the garage I described at the top of this video, and the first appearance of any symptom at all could be as long as 2 months. For 56 days, nothing. The person feels completely normal. They sleep, they eat, they exercise, they spend time with grandchildren, they go to doctor's appointments for unrelated things. The virus is present. It is replicating. Their immune system is responding at a cellular level in ways that will not surface as recognizable symptoms for weeks, and they have absolutely no awareness that any of this is happening. Then symptoms emerge, often suddenly, often at a stage that already looks like something is seriously wrong, rather than I might be coming down with something. This is the quiet window problem. The silence between exposure and consequence is so long that the two events have no obvious connection in most people's minds. The person who cleaned the storage shed in March does not connect that to the fever and muscle aches they develop in late April. They assume influenza. They wait it out at home. And they lose critical hours, sometimes critical days, before anyone understands what they are actually dealing with. This is why what I am telling you today is more valuable than any symptom checker or news headline, because the intervention that changes outcomes with hantavirus is not treatment, There is no antiviral medication approved specifically for hantavirus. The intervention is early, informed escalation to emergency care, and accurate communication with the physician when you get there. Here is the exact information you need to give a doctor in an emergency room if you have any potential rodent exposure in your recent history. I was in an enclosed space with signs of rodent activity approximately a certain number of weeks ago. I am aware of hantavirus and want to make sure that is being considered in the differential. That sentence changes the diagnostic process. It puts hantavirus on the clinician's radar early, and early supportive care, oxygen supplementation, fluid management, respiratory monitoring is what shifts outcomes. The window for that care to be maximally effective is measured in hours, not days. Know the symptom triad. Fever plus significant muscle aches plus shortness of breath, developing progressively within the 1 to 8 week window after any potential rodent exposure. That combination is your signal to move, not to wait and see, not to assume it is a seasonal bug, to move. Now let's address the global risk picture, because this is where I see the most dangerous misinterpretation of health information happening in real time. The World Health Organization and the Centers for Disease Control have assessed the overall population-level risk from hantavirus as low. If you have seen that language in the coverage this week and felt reassured by it, I understand why. And I also want to explain precisely why that reassurance may not apply to your individual situation. Population-level risk statistics are calculated by averaging exposure, likelihood, and outcome severity across very large, very diverse populations. They factor in urban populations, suburban populations, people in high-rise apartments with no rodent exposure history, people in countries with established rodent control infrastructure. When you average all of those people together, yes, the population level number looks low. Your individual risk is not determined by population averages. It is determined by your specific circumstances. If you spend time in rural or semi-rural areas, a vacation property, a hunting cabin, a family farm, your exposure context is meaningfully different from someone whose entire life takes place in climate-controlled urban buildings. If you work in fields that involve older structures, soil, outdoor environments, wildlife, pest management, or agriculture, your occupational exposure is not represented in the general population average. If you are in the process of clearing, renovating, or cleaning any structure that may have been unoccupied or rodent accessible for an extended period, that activity specifically elevates your individual risk in ways that population-level statistics do not capture. Low global risk is accurate information. It is not, on its own, a complete basis for your personal health decision-making. One additional note worth being aware of. The Andes virus, which circulates in parts of South America, has demonstrated documented cases of person-to-person transmission, a characteristic that virtually no other hantavirus strain shares. This is a notable exception to the general rule that hantavirus requires direct rodent exposure. It remains limited in its transmission efficiency, but it is the reason the cruise ship situation being investigated currently warrants the monitoring it is receiving. For every other major strain, including the strains most likely to be relevant to viewers in North America and Europe, the rodent exposure pathway is the mechanism. Person-to-person transmission is not a documented feature of those strains. I want to take 2 minutes here on something that sits underneath every conversation about infectious disease risk in this age group, and that is the reality of immune aging. Your immune system at 65 is not the same organism it was at 35. This is not a pessimistic statement. It is a biological reality with very practical implications. The process is called immunosenescence, the gradual shift in immune function that occurs across decades of life. Your immune system's first response speed, its precision in identifying novel threats, its ability to mount a vigorous inflammatory response and then regulate that inflammation back down, all of those functions become somewhat less efficient with age. What this means in practical terms for viral threats like hantavirus, your immune system may take longer to recognize and respond to the threat, and the organs it needs to protect are starting with less physiological reserve. There are specific things within your control that directly influence immune function in this age group. Sleep is the most underestimated lever. Consistent quality sleep of 7 or more hours per night is not optional for immune function. It is when your immune system does a significant portion of its surveillance and repair work. Chronic sleep restriction measurably degrades that function. Vitamin D status is disproportionately low in adults over 60, particularly in those who spend limited time outdoors. Vitamin D deficiency directly impairs immune response speed and the quality of the immune cascade. A 25-hydroxyvitamin D blood test is simple, inexpensive, and gives you actionable information. Ask your physician. Chronic inflammation driven by metabolic factors, elevated blood sugar, visceral abdominal fat, sedentary lifestyle, acts as a constant drain on immune resources. An immune system that is perpetually managing low-grade chronic inflammation has fewer resources available for acute responses to pathogens. And for anyone managing existing conditions, kidney disease, hypertension, diabetes, COPD, cardiovascular disease, please discuss any changes to your health management routine with your physician directly. The interaction between your existing conditions and the specific organ systems hantavirus targets makes your medical history genuinely relevant to how you approach this risk assessment. Let me give you the clean summary of what we covered today and what you actually need to do with it. Hantavirus is a known, studied virus family, not a novel emerging pathogen. It does not spread through ordinary human contact. It spreads through inhaling microscopic particles from the dried excretions of infected rodents in enclosed, unventilated spaces. The exposure is silent, odorless, and completely undetectable in the moment it happens. The incubation window, 1 to 8 weeks for most strains, 4 to 42 days specifically for the andesvirus, is the quiet window problem. It is what makes awareness and preparedness more valuable than any reactive response after symptoms appear. The symptom triad to know: fever, significant muscle aches, and progressive shortness of breath. If those 3 develop within 2 months of any potential rodent exposure, go to an emergency room and give the physician the specific exposure history. Do not wait. For anyone with access to rural properties, older structures, unoccupied spaces, or occupational environments with rodent exposure risk, assess now, not later. If cleaning is needed, follow the ventilate, mask, wet surfaces, never dry sweep protocol exactly and in sequence. And if your immune health baseline needs work, sleep, vitamin D, inflammation management, start those conversations with your doctor. Now, here's what I want from you in the comments right now, and I am genuinely asking because it shapes what I cover next. Do you have an enclosed space in your life, a cabin, a storage unit, a basement, a shed, that has not been assessed for rodent activity? Has anything in this video changed whether you are going to do something about that? And the second question, when you first heard hantavirus in the news this week, what was your initial reaction? Not what you know now. What did you feel in the first 2 seconds? Those 2 answers tell me everything I need to know about where this community's health literacy is and where it needs to go next. If this gave you real, useful information instead of just anxiety or dismissal, share it with someone who has been forwarding you the alarming headlines. Context is what they need right now, not more fear. And subscribe if you have not already, because next week we are going into exactly how the aging immune system responds to serious viral threats and what adults over 60 can do specifically and practically to optimize that response. Given everything we unpacked today, that video will be directly applicable to your life. Be informed, stay rational, and take your health seriously. And because no one else is going to do that for you, I will see you in the next one.